Hey everyone, welcome to The Zest, the official podcast of Lunch Biz Magazine. I'm Chelsea Ranieri, and today's guest is a fellowship-trained breast surgeon at the Hoag Breast Center. Thank you so much for being here today, Dr. Elizabeth Kraft.
Yes, thank you so much for having me. I'm so happy to be here and to talk with everybody about Hoag and breast surgery.
Yay! So when I was researching you, I saw that your full title is Breast Surgical Oncologist Oncoplastic Surgeon. Can you explain what that title means and what your role entails?
Yeah, I know that's a mouthful, right? But what that means is a couple things. So the first part is breast surgical oncologist. So that just means I am a cancer surgeon of the breast only. That's what the first part means. And that's a pretty common specialty throughout the country. The second part is oncoplastic surgeon. So that is something that, Hoag is a really big part of. It's part of training doctors to be oncoplastic surgeons. And what it means is we combine both cancer techniques with plastic surgery. So when we do that, that allows the cancer patients to look, pretty similar to the way that they come in, or, if they want to be bigger or smaller at the same time, we can also offer them that at the, initial surgery. And so it's kind of a pretty niche part of breast cancer surgery. And it's definitely not offered everywhere, but it's getting more and more popular because, patients obviously love it when they look like themselves when they come out of surgery. And it's been a slow evolution, but it's slowly taking off. And so I did a fellowship at Hoag and at the University of Southern California. They had a combined program that we do for a year. And it's the only oncoplastic fellowship in the country. And they train us in that way to, be able to offer that to patients. And the program has trained over 60 fellows now. So, if anywhere is offering oncoplastic surgery, it's likely by somebody that was trained at Hoag or USC. Yeah.
Wow. So is there only about 60 of your specialty? 60 in your specialty?
Well, it's actually expanding more because other surgeons that, are out of fellowship, they want to do it too. So there's definitely more than 60, but I'd say because most general surgeons that are practicing breast are trying to get courses or training in this oncoplastic surgery.
Wow.
So amazing. It's expanding even more. So there's more than 60, but I know 60 for sure.
Yeah. That's incredible. Well, I'm very excited to learn how you got to that point in your career, but I would love to start at the beginning. So,
Sure.
Where did you grow up?
Yeah. So let's go way back. So I am from the middle of the country. I'm from the Midwest. I grew up in Kansas, Wichita, Kansas, to be specific. And I had I describe Kansas to people because where are you from?
Orange County as well. So
Orange County. Okay. Yeah. So you've grown up in the most beautiful place, in the whole country, I feel like. But Kansas it's kind of like LA suburbs, but no ocean or, nothing to do other than suburbs. So, it was a very nice childhood, very safe, all that stuff. But, I always kind of knew that I wanted to live somewhere else. I have cousins that live in California. And then I had gone on a school trip to New York City and I was like, I'm not going to stay in Kansas. So, but I didn't really know what I wanted to do with my life yet. So I went to the University of Kansas for college, the big state school there. And I was initially pre-med because in high school, I was good at math and science. And when you're good at math and science, people tell you should be a doctor. And so I was like, okay, sure, I'll be a doctor. And the first person I ever shadowed was a plastic surgeon. And little did I know that would have, anything to do with my future. But in high school, we had a mentor day. And I just was like, oh, sure, I'd love to be a plastic surgeon. And I spent a day with this doctor who was wearing, by the way, he was a male and he was wearing a leather shirt. If you want to he drove a Porsche and he had a leather shirt and it was just your classic, stereotypical kind of Beverly Hills plastic surgeon, actually.
Yeah.
He was similar to that, but he lived in the middle of Kansas. So I don't know. They had the same vibe. But I spent the day with him and went into the operating room and just loved it. I had like this moment of, I didn't know what I was feeling at the time, but I was like, oh, it's very peaceful here. It's calm. I like it. It's controlled. This is cool. But I had, I'm always wanting to try things before I make any kind of decision. So I, thought about that. I was like, oh, that's cool. Okay. I could enjoy this if I did it. But I went then into undergrad and I was going through my pre-med courses and I was I don't know. I had gone through a lot of math and science classes that weren't really applicable to the real world. And I was getting kind of frustrated. And this was in 2008 when the financial crash had happened.
Oh, right.
And so I was seeing, all these headlines about Bernie Madoff and these major banks closing down and this mortgage crisis. And I was like, I don't know what they're talking about. I know nothing about any of these words, any of these phrases. And I should learn a little bit about this business stuff. And my dad, he's a pharmacist and he was like an entrepreneur and owned his own pharmacies.
Oh, wow.
And he said to me, yeah, it was kind of the only other option for him other than like working for CVS or Walgreens or something.
Yeah, right.
Yeah. So he just owned his own little pharmacies and would put them outside of doctors' offices so that, CVS or Walgreens, they couldn't beat him on that, right? Like on the convenience factor. Yeah. Yeah. So anyways, but he was lucky enough to have a partner who was an accountant. And he said to me, like, Ellie, if you end up doing medicine, like, please take a business class or two, because I had no idea how to run a business. I had no idea about any of this stuff. And many of the doctors that he worked with didn't either. And he saw them just having like huge financial issues. So
wow.
He, talked me into taking like an accounting class, a finance class, and I started reading the Wall Street Journal and all that stuff. And I really found it fascinating because, like I said, the world was kind of falling apart with this crash in 2008. But, it was interesting to like be learning about something and then see it in the news. So I found that really fascinating. And I ended up just taking more and more classes and being a finance major, actually, which is a little bit of a curveball from a pre-med person. But yeah, I was really enjoying it. I was liking it. And I started, hearing about job opportunities to go work in finance for a little bit. And, people were like, look, if you do medicine, you can never, it's very hard to back out. It's very expensive to back out. So, if there's anything else you want to do, be sure you check that out before you, dive completely into medical school and taking on that kind of debt and stuff like that. So anyways, I started a job at a private equity or I got a job as a financial analyst at a private equity firm in Kansas City. And I was like knee deep in Excel. It was so boring. I can't even tell you. It was awful. And I quickly learned that like I am a people person. I want to physically help people. I don't just want to like record someone else's kind of numbers and moves and stuff like that. So I had a real come to Jesus moment pretty quickly, luckily, about a year in, and decided, okay, this medicine thing that I tried before, I actually really loved that. And I never felt bored, like not a day in my life, even when it was annoying or something to learn organic chemistry. I still like absolutely loved helping people. So I kind of switched gears and went then full speed ahead to go to medical school. So I quit my job. I got a job at a family practice doctor's office as like a off the books medical assistant. I didn't do any training. I just went in there and said I wanted to go to medical school. And so I was giving like vaccines to children or, like to 1-year-olds, 3-year-old, like that is one of the worst jobs in the world. I will tell you.
I can't even imagine. I'm such a baby about getting a vaccine. I can't imagine doing it on a 1-year-old.
Oh, it's so sad because you have to hold them down and like, yeah, it's horrible. And I also had to clean out earwax. Like those were the two like main parts of my
satisfying though. Like kind of
yeah. Oh my God. It was. But you use like this little water pressure cooker, and it just like squirts out like a rock of earwax. It's disgusting. Anyways, I did that while I was applying for medical school and luckily got in. And then, once I got into medical school, I wanted to explore everything, but my surgery rotation was actually last. And so I tried literally every other specialty. I tried to like OBGYN. I tried to like medicine. I tried to like all the things, psychiatry, anything, because honestly, like everyone, told me, especially in Kansas, they were like, look, if you're a woman, it's very hard to be a surgeon. And I got a lot of discouragement, I would say, from, just other doctors that I was working around. And I ultimately finally got to my surgery rotation and was in absolute heaven. It was kind of the same feeling that I had back in high school when I spent that time with the plastic surgeon. And I was like, look, like I've got one life. I don't care if people tell me I can't do it because I'm a woman. Like I'm just going to do it. I'll figure it out. I'll make my own way. I love this so much. I've just got to do it.
What did you love about it? Like, cause it seems, I think I would pass out if I saw everyone does naturally, but really? You just, totally. And the first time, so I didn't mention this, but that first time that I was in that plastic surgeon's office, I had to like sit down. Whoa. I had to take a chair because but I
still loved it. I mean, I knew I could get past that. So, but it's really just, simple conditioning. So you just go enough times like that, you stop reacting to it. And that's how you get through. I mean, even in residency or something, when I would see some really terrible like trauma or something where someone's, I'm not going to be too graphic, but body parts are like in half or something, like those times you're still shocked. Like you still have your stomach that turns a little bit. But our training is so long and so like intense that you just get beaten with it over and over and over and you stop reacting essentially.
Wow. What did you love about it? Like, what did you initially like?
So I loved, I guess the peacefulness of it. I don't know how to describe that. Right. Well, I'm not talking about trauma surgery, but I'm thinking of like an elective surgery. So this means a surgery that you have planned. Mm-hmm. So it's not, something that you come in for the middle of the night, but if you plan something, there's music on, it's cold, it's kind of cozy. And it's kind of like if you do arts and crafts or anything and like have music on while you do it, it's similar to that. That's how I describe it to people.
I do love that.
Yeah. So like for me, like I like painting as a kid, and it is the same like flow state as that where, like time is, irrelevant. Like you blink and it's an hour kind of thing. So I think
that with writing.
Yeah. But the flow state is what I ultimately, when I wasn't in flow state, that's for sure. I was like, oh my gosh, what's going on? Where do I stand? Am I doing something? But I knew enough to know that like, oh, the surgeon is just like using their hands and like enjoying that. And that part of it, I just loved it. It was like nothing else. The rest of medicine, a lot of it is like paperwork or writing notes on a computer and like talking to the patients is great, but that's only a little part of your day. The rest of it isn't that exciting. And I always found whenever we were doing a procedure or of any kind, I was excited. And I was like, okay, that's not normal. That's not how the rest of my classmates are. Like some of them hate it. Some of them don't want to do anything with the procedure, but it probably comes down to the control factor.
And you can tell those doctors too that aren't like, I've had doctors before where I was like, that's a bump. Like you clearly just want to get me in and out and go. And then you can tell the doctors who are really genuinely like caring for you.
Yeah. And it is immediate gratification. So I love immediate gratification and, And it's, somebody telling you like, hey, you should lose weight. We'll see you in 6 months,
right.
That, who knows if that's going to work out, but in a surgery, if your appendix it has ruptured. And we go in there and we take it out and you feel so much better. That moment when the patient is like, oh my God, you helped me so much. Thank you. Like, that's why we do what we do, right? Is to help somebody and like make them feel better. And surgery is like the most, raw form of that. Right. And so yeah, I love, my ego being boosted every time.
Do you have like a memory of like a patient that impacted you positively?
Every day. Yeah. Positively. I would say, well, I'm lucky enough, to treat just breast cancer patients now, who, I'm thinking to one patient in particular that I recently cared for at Hoag. She was just this lovely, about 40-year-old woman who was diagnosed with a really bad cancer. She had to get chemotherapy before our surgery, which we do sometimes to see if the chemotherapy will dissolve the cancer, essentially. And she, when she walked in the door at first, she wanted a bilateral mastectomy. So that means she wants both of her breasts removed. She wanted, nothing to do with this ever again. And I, talked her off the ledge. I said, if we can make this cancer disappear, then we can do a very small surgery and you can look like yourself at the end of this and not be dealing with all the complications that can happen from a mastectomy. It just, because basically when we do a mastectomy, that means we're taking out the whole breast and that cuts through nerves. It, your nipple never works again. You might not get to have a nipple. There's all kinds of very serious long-term side effects that not only physically, but sexually, you're completely different, and this lady's 40 years old. She's got a long life ahead of her. But I talked to her about all the options and I said, let's wait and see, let's do the chemotherapy and see what you want to do. Of course, I'll do the double mastectomy if that's what you want at the end of this, but let's really think about your life in 5 years and how you want to feel. And if you want to get dressed every day and just be reminded of this moment, or if you want to get dressed every day and you're able to forget, you're able to have like peace with this. And so I was able to, she did the chemotherapy. She was convinced to just do the smaller surgery. And she also got a breast lift at the same time, which is a lot of the time what we do. A lot of the time we'll take out the cancer and do like a lift and breast reduction. Because as we all get older, if we're have our bra off at all, like our breasts do drop as time goes on. So eventually most people need some kind of lift or reduction. And so we're able to pair that with the breast cancer surgery. And so, this lovely, young, vibrant, beautiful 40-year-old lady was able after this, horrible diagnosis to look absolutely amazing. And she was so, thankful at the end of that for talking her out of, this bilateral mastectomy, which is a big deal, and it's still a real option that we have to use sometimes in certain patients who aren't candidates for the smaller surgeries. But it was really amazing to just see her result in her, mental state and, her marriage wasn't going to change or anything, like all that stuff you have to think about too. So she was really special and I'm so glad we could help her and kind of help her navigate this journey. Cause it's, especially when someone gets diagnosed with cancer, they just want like to shoot nukes, like they want things out fast and they forget that like they have a long life ahead of them to deal with that choice. So that's what oncoplastic surgery helps us do, is kind of make that a reality for them. Yeah.
So is that the breast lift? Is that part of oncoplastic surgery, or is that something that
Yeah. So that's part of oncoplastic surgery. And the great thing is a lot of plastic surgeons can help surgeons that aren't, versed in that. Yeah. So a lot of the times what people do who aren't prepared to do the reduction themselves is they'll have a plastic surgeon come in and do the case with them. But it can just be a challenge of getting two surgeons in a room. Not all plastic surgeons do reconstructive surgery because insurance sadly pays really poorly for it.
Yeah.
So it's hard to find those plastic surgeons that will do it. But we're lucky enough at Hoag that they have, a huge team of plastic surgeons and breast surgeons that all work together. So at Hoag, we do use a plastic surgeon to do it too, just so we can work at the same time. Even though, if we were in the middle of nowhere, yes, we could do it by ourselves. But we have the resources, so we want it to cut the surgery in half and, just use the power. Two hands are always better, or 4 hands are always better than 2. Yeah.
Yeah, definitely. And okay, so as a breast surgeon, you've obviously seen a lot of different conditions and issues. With the knowledge that you've acquired in your position, what are 3 things that you would never do regarding breast health?
3 things I would never do regarding breast health. So I would never skip my mammograms. That's number 1.
Start at?
So age 40.
Okay. Wow, so she just got it. Your patient had just got it and just started.
Yeah.
Wow.
Yeah. One of her first mammograms, which luckily for us, that's rare, but it's, it's possible to happen. So age 40 and sadly, people are popping up younger and younger with this stuff. And we don't really know why that is. We don't know if it's an environmental factor or our diet or what it is, but yeah, there are younger women getting this. So the recommendation is for 40 years old to start getting mammograms and get them every year. So not every 2 years, every year.
Wow.
Mm-hmm.
Yeah. I've heard it's painful.
So I've never had one.
Dude, have your patients told you if it's painful?
Yes, because I'm not 40 yet, but yes, patients don't love it. But let me kind of explain the difference between that and the other types of breast imaging, because I had a patient the other day ask me about, I think it was like thermo ultrasound or something like that, that a lot of places are offering for cash. And I will say this, there are 3 tests that tell you about your breast, and they're all different. So I describe them as like a knife, a fork, and a spoon. You can't use either, or, any of those by themselves, but together they all work to show you what you need. But basically a mammogram is an X-ray of the breast, and that can find certain very early type of breast cancers that show up as calcifications, which are little specks. They look like sand on a mammogram.
Oh, wow. They're that small?
Yeah. They're very small. They're very small. And so that's and mammograms are what like your insurance is going to pay for automatically, yearly mammograms. The problem with mammograms are the younger you are, the more dense tissue you have, which dense tissue just means like, if you think of a young girl, like let's think of a 14-year-old and her breasts, they're very perky, they're very high, and they stay up like that because she has very youthful breast tissue. And then think of like an 80-year-old lady, and her breasts are more like kind of tube socks. So in that situation, they're full of fat. And actually the 80-year-old is what the mammogram prefers to look through, because all the fat is easy to see through. But when you have younger breasts, it's harder to see through. Okay. So that's why we always start with a mammogram. But in some people who have what's called extremely dense breast, then we can offer other tests. The society that help or like accredited or the radiology society that looks at all of these things for breast cancer patients, they actually just acknowledged that this, breast density is an indication for MRIs. So MRIs are like a high definition test that can be done in patients to look inside as well. So especially if someone's like has a high risk of breast cancer, so that'd be somebody who has like multiple family members with breast cancer, something like that, I would definitely encourage you to talk to your doctor about trying to get you an MRI for the breast. Yeah. And the third test is an ultrasound. So Hoag also offers this too. Like if someone has very dense breasts, an ultrasound is another test that can look kind of through the breast tissue a little bit better than the mammogram. It's not as great at it as the MRI, but it's definitely better than just the mammogram.
Okay.
So Hoag offers the ultrasound screening as well. And they are offering, the MRIs too. So if your physician can offer it or order it at Hoag, then that's something that would be good too.
Yeah. So, okay. So you would never miss a mammogram.
Yeah. So I'd never miss a mammogram. What else for the imaging is really kind of the trick. I would never miss a mammogram. I would, never miss like even a pap smear, cause that's kind of the same thing. It's again, catching something so early that it's not a problem. I'd say, be sure to get your pap smears and stuff like that, cause that all can go hand in hand. And I would just never kind of ignore something that's different. That's okay. The third thing. I would never ignore a body change that you notice, especially with your breasts, that is unusual. And I encourage everybody to do, once a month when you're in the shower, just like, check your breasts. You don't have to go crazy, but just know how they feel. And so if there's a change or something, you're going to be the one to identify it. I wouldn't wait for your once a year physical with your OBGYN when you're, awkwardly in stirrups to like expect them to do everything. Cause it's just that relies on that person. Right. And you really know your body best. So I think if you notice a difference in your body, do not wait. Do not wait to bring it up to a healthcare professional. I know naturally a lot of us want or are in denial. Initially, right? Like I don't want there to be something here. And so you ignore it. But I would say, especially in the breast cancer world, in any kind of health issue, the earlier, the better. The earlier you figure stuff out, the easier the treatments are, the quicker the treatments are, all stuff like that. So I think never ignoring a difference in your body is super important. And I sadly see this all the time. I'll see somebody who's had a lump for 2 years that they that they just couldn't bring themselves to, address. And luckily for breast cancer, at least a lot of the times when we find it early like that, it's, it's not a death sentence. It's not,
right. So I was in Girl Scouts, and Girl Scouts is really great. They taught you how to check for signs of breast cancer. But are there other things that we should be looking out for as well, besides lumps or anything outside of the realm of breast cancer too?
I mean, I would say like notice any changes in your health, like and how you're feeling, right? Like if you're feeling more tired than normal, if you're losing weight, more than like 10 pounds over a month when you're not trying to lose weight and you don't have some huge stressful event, keep an eye on that. Just be sure to check in with your, doctors, and especially when we're young, right? Like it's easy to not go to the primary care doctor. Right. It's easy to not do that stuff. But I would say just check on your, blood work and everything, and make sure your vitamins are okay and all that. So, it can be a whole slew of things, but I think just, being in touch with your body. And if there's something that's different, being sure to get it checked out and just make sure that, maybe it is just something that's stressful happening, but there's all kinds of stuff with our thyroid, and, there's just very common things that can really make a difference if you figure out what it is, and just make you feel so much better. But yeah, as far as the cancer awareness goes, obviously for the breast, just be aware of your tissue, and then, talk to your family too about what the history is. I noticed that too a lot, is that people don't really know their family history. And, they're like, oh, grandma had breast cancer, but I don't know when or where or what it was, or just kind of getting your family history. 'Cause that does, give us a hint, at least, of if you're a high risk patient or not, is your family history. So I think being familiar with all that is super, super helpful too.
Definitely. And I do want to ask about your podcast. So you started Self-Care Surgeon. So how did you start this?
So I started it, or I had kind of an inkling for an idea about it, but I started it right when I finished my training, or kind of got the idea for it right when I finished my training, because basically, yeah. So I had spent time at Hoag, during my fellowship, and I was working at my first job, and there were all these things coming up that I had never learned in medical training. And I mean, I did 10 years of medical training. Like you think they covered everything, but they didn't. And, you know, I got really, really good advice from a lot of my mentors at Hoag and at USC. And I had noticed that all of my friends who were in the same spot as me, they had exactly the same questions. And I was kind of telling them the same things over, you know, it was like, how do you negotiate a contract for a first job? How do we invest? How do we pay off debt? You know, like we had learned none of these things that are like adult things, right?
Yeah.
Like, and we had done none of them. Yeah. Well, and I also, or let me go back a little bit, because I had also been a resident in New York City during the COVID pandemic. And so I myself was, you know, on the front lines. I was scared to go to work, but wanted to help out. You know, I watched people, like the security guard that I said hi to every morning, I watched them pass away from COVID. You know, like it was a traumatic time for so many healthcare workers at that time. And I saw people burning out left and right. And I saw, you know, how depressed people were, and people were leaving in the emergency room or emergency medicine. You know, people in droves were leaving medicine because, you know, they were going through this horrible time and they had no tools to process it. And, you know, I myself, during that time started looking into things to take care of myself because I didn't know how to process this stuff. I had, you know, never had anything like this. And so I first started doing yoga. It was just as simple as yoga. I could handle that. I did it like virtually in my living room. Shout out to Melissa Wood Health. I have no affiliations with her, but her, like $10 a month program. I mean, I've done it for the last 4 years now. And I mean, it saved my life. Like it really did. She's just a super calming presence. She was also in New York City, filming these like 10-minute, 20-minute workouts. And I found that just moving my body helped me so much. And then I started dipping my toe in. She talks about meditation. She talks about journaling. She talks about, you know, your diet and how important that is. And I learned so much from her. And then I was like, okay, this stuff is really helping me go through this hard time. And it's making me feel less burnt out. Right. And so I was like, okay, everyone needs to know about that. You know, they don't all need to do Melissa Wood, but they all should know about these tools to help with this really hard time. And you know, there's like physician suicides happening more and more.
My God, I didn't know that.
Yeah. It's actually, it's on the rise after the pandemic, just because of, you know, many factors, but the pandemic was a big part of it because people were, you know, really overworked and had more like paperwork demands. You know, it was a lot of reasons, but yeah, the physician suicide rate is really, really alarming. So yeah, it's horrible. It's absolutely horrible. But anyways, I wanted to kind of share these tools and kind of bring it all together under one roof to talk to my, you know, friends and colleagues about what I had learned and, you know, what was successful for me and for one of my best friends who's a trauma surgeon. And now she's a breast surgeon too. Wow. But she and I lived in New York City together during this time. And, you know, we just really enjoyed talking about these other parts of medicine that help us take care of ourselves and help us get through the day, you know? And so, yeah, we started this podcast and it's been, you know, such a wonderful thing that I've gotten really like lovely feedback from, and, you know, people just appreciate it so much because it's kind of like a central hub to talk about kind of the things that we're not always encouraged to talk about at work, you know?
Right. Totally. Yeah. You can't really talk about burnout while you're at your job that's burning you out.
No, definitely not. Or like contract negotiations, or like, how do you take care of yourself when you're on call, or how do you set up your operating room? Like that was kind of a fun one that I thought of the other day, or one time, because I was like, oh, like not everybody was taught how to like make your operating room nice. Because it's interesting when we're training, we have to go through, we basically have to follow different surgeons and see their operating rooms. And, you know, you don't really know why some rooms are different, but some room we walk in and it's just tense. Like you would hear a pin drop, like everyone's on pins and needles. Everybody's nervous. Everybody's scared. The surgeon's going to freak out, you know, so that's one vibe. Another vibe is like a really kind of like grandpa like guy who's super sweet, has everything under control, but it's very calm. And, you know, there's nothing that's going to throw that person off. And then, you know, the third person has music blasting and they're having a great time and making jokes. And it's also like amazing stuff, but it's very intense. So I remember noticing that and thinking about, okay, I need to be really intentional about my OR and what I want to have the room be like, because as the surgeon, you're the leader and like you set the vibe. So, you know, just even talking about that, people were like, oh my God, I didn't even think of that. And as a new surgeon, there's all this stuff that comes up that you're like, okay, I'm the boss now, but how do I be the boss? I don't know.
No, it's not me like picturing your operating room and being like, dang, I want to be in there. Like,
No, there's this amazing meme and it's like, there's this amazing meme and it's like millennials in the operating room and it's like, you know, Kid Cudi or something like, or some like rainbow strobe light and techno music. And there's no like rainbow strobe light, but there is like house music for sure.
Yeah. That's so funny. Yeah. What's your favorite music to do a surgery to?
So I make my own mix actually, because I can't rely on Spotify always. But it's mostly like pretty upbeat, like DJs and stuff like that. So.
Oh my God. How cool.
Yeah, it's great. It's like, exactly. It's my happy place. Like, I just love it there.
Yeah. That's I'm like thinking about all the like random little surgeries that I've had. I just shared this one story. Like this one time, a nurse, like my last name is Rainieri. And I don't know if you know the cult Nexium, but she was like, Rainieri, any relationship to Keith Rainieri? And I was like, it is spelled differently. And why would you ask me that before you're about to operate on me?
Absolutely not. No.
I was like, even if there was a relation, I'd be like, no. Like,
yeah, exactly. So no, weird. I don't know him, Dad. No, absolutely not.
Exactly. No, for real. It's like so funny. But so we're coming to the end of our time, but before I let you go, I have 3 final questions for you that we call the Thoughtful 3.
Okay.
So what advice do you have for someone who's experiencing burnout?
I would say if you're experiencing burnout, like let somebody know, you know, let your friends know, like do not suffer in silence. I guarantee other people are feeling what you feel. And you know, I really think we are such like, you know, group creatures, right? Like we are tribal, you know, essentially. And I think the more that you can, you know, just use your group, you know, to help you up and use your, you know, use tools that you can learn on your own too. And self-care surgeons, obviously, but, you know, like use your support system and let them know that you're suffering. Never suffer in silence. That's kind of the common theme that so many of these, you know, horrible stories of people burning out and taking their own life is they were suffering in silence. Nobody knew what was going on with them. It was just, they were gone one day kind of thing.
It's so horrible.
Yeah. It's awful.
What would you tell your younger self knowing what you know now?
My younger self, I would tell her it's gonna be okay. And don't listen to the naysayers. Cause like I said, I really did get a lot of people telling me, oh, you don't want to do surgery. You can't do that, you know? And I ultimately didn't listen, but Man, I stewed about it for a minute. I wish I would have just listened to myself earlier and followed my gut earlier, because your gut always knows, you know.
Right. So true.
Yeah.
And then lastly, if listeners can just take one thing away from this conversation, what would you want it to be?
Please, please, please get your mammograms. That's what I would say. Please get your mammograms when you turn 40. And be sure you're seeing your OBGYNs and stuff like that, because they'll plug in if you need to get it earlier than 40.
Oh,
for you.
Interesting. Mm-hmm. Okay. That's good to know.
Yeah.
Amazing.
Yeah.
Well, thank you so much for doing this. I learned so much from you. This was so much fun.
Oh, absolutely. I had a great time. And I'd love to, talk again anytime. This is great.